Welcome back. We're talking to Tina Eblin of ChildWise Institute. Thank you, Tina, for addressing this important information. So before the break, we were talking about resiliency. So talk to us about that. What is it?
So resiliency is the ability to, when you're dealing with something difficult, be able to then return back to normal and cope with the issue at hand.
So is teaching resiliency something that healthcare providers and maybe educators can do?
Absolutely. Different things like mindfulness, meditation, physical activity, also, getting enough sleep can all help with resiliency.
So we hear about trauma-informed care. So what can a provider or an organization do?
Well, for a provider, what's really important is to understand, especially if you're a healthcare provider, that a lot of clinical issues that people present with could be tied to stress, and having that understanding. As for organizations becoming trauma-informed, really understanding that all of us have stress, which is really what trauma is stress, and that they have the ability to help employees or help patients dealing with stress.
I hadn't heard much about trauma-informed care until fairly recently, the last year or two. It sounds like a new movement. Is it?
It is. I would say within the last 5 years, it's really taken off. Yes, I think in the future we'll see way more organizations understand that becoming trauma-informed is an important piece to business.
So are there organizations in our own communities that are trauma-informed?
So there are organizations that are working towards it. Intermountain is one of those, Show Dare is one of those. Also, we have a business in town that is really working to become trauma-informed, and that's the McDonald's in Helena.
Oh, that's good to know. So what does an organization actually have to do? I mean, is it a certification or accreditation?
Currently, no, it's not. For us, like working with McDonald's, it was training upper management and getting their buy-in with understanding why is it important to understand adverse childhood experiences, and being able to train managers and supervisors to recognize when their staff is stressed or when their staff is dealing with difficult situations.
So if I went to my provider and I'm ill or needing some assistance, how would I be able to tell if my provider is trauma-informed? Would I notice anything if I were a victim maybe of trauma as a child?
The only way I think you would be able to recognize is if they ask for your ACE score or ask you to take the ACE survey. That's how you would recognize if they're trauma-informed.
So are there a lot of providers around that are getting training on ACE and how to administer that tool?
So there are more and more providers that are wanting to understand the impact of adverse childhood experiences. Currently in Helena, there are pediatricians who are giving the ACE survey to parents. And seeing, what that score is and helping connect them to different things like parenting classes or mental health providers.
So let's go back to ACE. Give me some examples of some of the questions. You probably have some of them memorized by now, right?
So one question is, did you grow up in a household where someone had an addiction issue to drugs or alcohol? Another one is, did you grow up in a household where you lost a parent or a caregiver? Or did you grow up in a household where you went to school not fed, or you had dirty clothes, or you didn't feel like you had attention? So that's a neglect question.
And remind us again, if it's a score of 4 or more, you're at risk?
Well, you're basically at risk at any score from 0 to 10, but the tipping scale is 4 or more. So they have found that there is a dramatic increase in physical health problems, the possibility of having physical health problems at 4 or more. So it increases, like heart disease increases over 300% if you have a score of 4 or more.
Amazing. So we talked about children and being administered the survey, pediatricians and the like. What about adults? Should that be used for adults as well?
I definitely think it should be. It will give an insight to maybe there was a lot of stress in this person's life, and maybe that's what has led to the diagnosis that they're seeing their physician for. Yeah, I think it should be administered to adults as well.
So there's some educational programs around that I've seen maybe in the newspaper on the ACE scoring system. So talk about that. Are there any upcoming sessions or anything that someone who wants to be educated about ACE?
So people can always go to childwiseinstitute.org to get some information, also elevatemontana.org. But we have 11 communities within the state who have become Elevate Montana affiliates. And within those communities, they have people who have been trained to present on adverse childhood experiences. So they are going out giving presentations quite often.
Oh, that's excellent information. Thank you so much, Dina. Well, coming up next, talking about cultural issues is a great segue to our next guests who will join us to discuss trauma-informed care in Native American healthcare organizations. Stay with us.